All right, guys, we're back. I recognized on the break I've already had quite a bit of caffeine this morning. Like I said, if I was yelling at you, deal with it. I do get really excited actually about these basic concepts, and I know maybe they don't sound basic or feel basic right now because you are already trying to attach a lot of details to them. What I strongly recommend is that you just keep your foundational ideas in mind, right? As a thinker, I like to have a global picture. So I think personally from the standpoint of our curriculum, having a global picture, what are the three things the nervous system does? How does the brain basically work? Survival prediction, et cetera, et cetera. Understand the neural hierarchy, visual, vestibular, proprioceptive. What happens when we don't have good matching of those GPS systems? All these different issues. These are overreaching foundational concepts that you then hang exercises on as you move forward. So it does not need to be complicated in order to apply it. We are going to start adding some detail now throughout the rest of this today and tomorrow as we finish up the live stream. What I want to make sure of, however, is that you don't get lost in the detail. Because whenever people go to R phase and I phase, sometimes because we're introducing new concepts, new language, new terminology, we're introducing neural pathways, it's easy to get lost and not start. You cannot use a level of confusion as a reason to not initiate using the drills, right? You know enough. You know to assess people, you know to reassess them. You know how to do the basic exercises. So even if you don't understand exactly, should I choose right side or left side with the visual system, what exercise goes with this part of the cerebellum or that part of the cerebellum, do not let that hold you back from initiating the process of testing. Because even though you may learn the anatomy in perfect order and in great depth, people are still allowed to have more than one problem when they stand in front of you. So you may know everything perfectly and still make the wrong decision about what drill to give someone. So the ultimate driver for what we do in a session is still going to be the very first thing that we talked about in Essentials, which is test and then check your work, right? Assess and then reassess. These are critical ideas, regardless of the amount of information that you have available. So don't let the detail derail your practice. All right, so, sorry. Dominant system, this is where we're starting. In our neural hierarchy, the visual system we say is our dominant neural system. That is not, again, always true, but from a learning perspective, as we begin, I want you to think hierarchically visual, then vestibular, then proprioceptive. And this is going to come down a lot to the basic anatomy of the visual system. So what we're going to do here is we're going to start off by introducing eye movements, and we're going to show you where in the curriculum we're going to spend more time on them, dig into them in detail. So whenever we talk about eye movements that people make, and remember, I need to be sure that you're clear on this, eye movements are not the only visual skill. All right, this is just one bucket. Whenever we talk about the visual system, there's 4 primary categories we get into in S phase. Eye movements is one of them. But visual resolution, how clearly can I see stuff? Visual acuity, how's my daytime vision? How's my nighttime vision? How well can I see something that's moving? That's all in the visual resolution bucket. We have depth judgment. How well can I judge where things are in space in relationship to things around them? That's another bucket. And then our peripheral awareness. How well can I see everything that I'm not looking at? That's bucket 4. But in terms of utilizing vision work to immediately impact on the GPS systems, we want to focus on bucket 1, which is eye movements. So whenever we talk about them, they have different names. All right, fixations. A gaze fixation is exactly what it sounds like. I'm staring at something and I'm not allowing my eyes to move away from it. All right, gaze fixations. Smooth pursuits, exactly what it says. I'm going to follow a moving object with my eyes and hopefully do it in a smooth way. All right, they're not called irregular non-smooth pursuits. Irregular non-smooth pursuits is usually given a diagnostic term. So a smooth pursuit is exactly what we want to achieve, which is follow a moving object smoothly with our eyes. Then we have saccades. Now a saccade is a quick change in my focal attention, because sometimes we need to move our eyes so quickly that a smooth pursuit is impossible, right? So if I'm looking at this camera and then I hear a sound over here, and this sound is scary to me, I want to immediately shift my eyes to see what that sound is. So that is not a smooth pursuit because I'm not following a moving object. I am looking here and then quickly looking over there. That's a saccade. All right, from there, we have vergence. Whenever our eyes come together and move apart, this is convergence and this is divergence. This is very much related to tracking moving objects, but also looking at things up close and in the distance. VOR, vestibulo-ocular reflex. Now, the VOR, the vestibulo-ocular reflex, we are going to spend a lot of time on in this particular class. This is a reflexive system that is built on interactions between the visual and vestibular system. So while it is called the vestibulo-ocular reflex, because it's driven from the vestibular system, remember the other word in there is ocular, which means eye. So vestibular, ocular. Vestibulo-ocular. Vestibular system, visual system. We need to make sure that the VOR is high functioning in our athletes. So we're going to be spending quite a bit of time on that. And then finally, we have what's called the OKN. Optokinetic is what OKN stands for. And in the structure course, we'll talk about optokinetic testing. But optokinetics kind of relate to reflexive and voluntary, but primarily in our interest is reflexive, smooth pursuit saccades. So if you can imagine sitting in a car, you're not driving, hopefully, like in a passenger seat, and you're driving on the freeway and you're driving at a fairly fast speed, and along the road are either fence posts or light poles, and your eyes are looking ahead and you're watching one, and then your eyes are switching to the next one. So that idea of a smooth pursuit and a saccade, smooth pursuit and a saccade, that is called the optokinetic system. And it is one of our, again, more important functional systems for us as human beings. And there is both visual and vestibular components to that. So these are kind of the 6 major eye movements. In our curriculum, gaze fixation, stabilizations, we will be working on here in eye phase. Smooth pursuits, we will be doing here in eye phase. When we go to saccade testing, we will do a lot of saccades and vergence in the S phase course. Whenever we get into VOR, back to the vestibular system, that's for this particular class. When you get into the optokinetics, which because there's a little bit more neuro involved in those pathways, we dive into that in more depth in the structure course. Now, I'm just showing you this so that you understand that we don't put all the vision work in one course because it would have to be 3 weeks long, and we want to make sure that you're learning more than just vision. So we have intentionally chosen, as we go through the curriculum, what grouping of exercises to put into which course. And it's all related to the introduction to the information and the integration of that information with other things within that particular program. So in eye phase, gaze fixations, smooth pursuits, vestibulo-ocular reflex, what's called vestibulo-ocular reflex cancellation. These are the things that we're going to be focused on. Why we focus on these in eye phase is that they are considered by many experts in the field of neurology to be the most foundational skills. All right? Your ability to look at an object, gaze fixate, stabilize your eyes. It's a complicated neurologic process, but if you cannot stabilize your eyes, everything else about your visual system is often compromised. So at a very foundational level, we need to be able to stabilize our eyes, and then we need to be able to follow moving objects. We need to be able to stabilize our visual system while our head is in motion and while our body is in motion. And that is related to the vestibulo-ocular reflex. Okay, so we'll be going through those in depth in this particular class, and then as you go into the other parts of the curriculum, we'll add more detail around some of the other movements. So obviously this is our menu for today. Fixation, smooth pursuits, VOR, and VOR cancellation, all right? So it's going to be a busy day of discussing neurology, but once again, I started this whole section by saying, please do not let the details stop you from initiating the work on yourself and testing people. You can learn the anatomy as you go forward. You want to make sure that you understand the basics first so that you can start testing, and then you add the anatomical detail moving forward. Okay, basics about the visual system. We said that the visual system in the neural hierarchy is our dominant neural system. Here's some kind of basics that people will discuss with regards to visual system neurology. Number one of the made-up statistics that's out there is that 70–90% of all sensory input is visual. Is that really true? We don't know. But it is a good reminder that when we're moving through the world, our primary predictive sense is our visual system. The visual system does produce a tremendous level or a tremendous amount of data when we're moving through the world. So this idea of it being 70 to 90% of all sensory input may have a strong factual basis, but this is a statistic that some scientists just kind of made up at some point. You can't really find papers that say, yes, the visual system provides 72.6% of all sensory input, because it would be contextual. But I want you to recognize that that statement is there to get you thinking about how important it is to focus on improving visual system function, because it is one of our most critical input systems. Input, integration, interpretation, decision, output. You want to change how people move, change how people see. Pretty simple idea. All right, more information about the visual system. We look at the basic anatomy. This is the eye. The cornea of the eye is here. We have the pupil. We have the pretty iris with its color. We have the lens sitting behind that. We then have what's called the vitreous humor, so the globe of the eye, what it's filled with. On the back of the eye is the retina. The retina is where you're going to find your photoreceptors, okay? So the retina is going to feed neurologic information into the optic nerve. The optic nerve, one of our cranial nerves, it is responsible for sending all the signals from the retina to the brain, all right? Now, the retina, each eye on the back of the eye has about 130 million photoreceptors. Photoreceptors are responsive to different wavelengths of light. We have RGB, so red, green, blue photoreceptors. So that allows us to see color, hopefully, for most of us. We have other photoreceptors that are responsive to blue light that communicate with the pineal gland. So there's a lot of stuff going on in the eye that is not related directly to vision, but is related to our hormonal responses to day and night. But all of that is going to be kind of encompassed in this photoreceptor grouping, right? 130 million on the back of each eye. Those 130 million photoreceptors will condense information to send into the optic nerve. The optic nerve is composed of about 1.2 million axons. Why I think this is really important, just on a statistical level or a mathematical or numerical level, remember when we were talking about voluntary movement? We said the primary pathway for voluntary movement on the left side of the body is going to come from the right cortex via something called the corticospinal tract. And I mentioned yesterday that when we look at the anatomy of the corticospinal tract, it's composed of about 1 million axons. So when you think about all the different things that we do with our body, all the movements that we're capable of, all the fine level of detail, we are doing all of that with less axonal density than is devoted to vision. All right, so we have 1.2 million axons just for vision. We have 1 million axons for all of the voluntary movement stuff. So whenever we start to think about this, hopefully this idea of 70 to 90% of all sensory input is visual, and the importance of the visual system and the neural hierarchy makes more sense to you. All right? As we keep going about the visual system, the wiring of the visual system is very complex because we have information from the right eye that goes both to the right brain and left brain. It crosses over in the midline. You've probably seen pictures in the past when you look at something, when it hits your retina, it's upside down. So the processing of vision is quite complicated, but what you need to know from an eye face perspective is that as the brain is processing what you're looking at, it's going to process it in two different streams. All right, one, and this is called the dual stream hypothesis of vision, because we're still learning about the visual system, but one is called the dorsal stream and one is called the ventral stream. All right, we'll talk about that more in just a minute. This is, again, just basic ideas about how does a visual system work. So we have light, right? We have some kind of light wavelength that is in front of us. You can see that our eyes are going to process information in kind of this weird way, where information is going to go either to the lateral side of the eye or the medial side of the eye, and I'm talking about the retina, the back of the eye. That information is then either going to stay ipsilateral and go to the occipital lobe or move contralateral. That depends on what section of the eye, what section of the retina is receiving the visual input. This, again, can get a little bit complicated, But right now, the easy way for you to remember this is using the exact rules that we've already given you. So think of it this way. When we say all sensory input eventually goes to the contralateral cortex, that does apply in part to what happens in the visual system. So if you want to stimulate the right cortex with vision, you want to put information into the lateral side of the left eye, all right? So again, just think about things on the outside crossover, all right? It's kind of an easy way to consider it. Now, if you track through the anatomy, we have the optic nerve, we have the optic chiasm, we have the optic tract. We then have this very, very important thing called the lateral geniculate body. This is found in the thalamus. We have information going back and forth to the midbrain, and then we have processing in the visual cortex back in the occipital lobe. So whenever neuroscientists talk about the visual system, they will say, depending on what visual task we are giving someone, if we're doing a functional MRI or kind of a near study or whatever of the brain, you will see enormous amounts of activation occurring during a visual task. You may see 25 to 35 different areas of the brain becoming active when I give you a challenging visual task. So in terms of brain activation, in terms of input, integration, activation, visual work is incredibly powerful. And what we have to figure out is, how do I use the visual system to target different areas of the brain? Now, this is a grouping. This is just kind of the basic anatomy. From an eye phase perspective, you really don't need to know this in depth yet, all right? What I would recommend is you take a look at this and just start to understand that there are different areas of the brain obviously involved in the processing of vision. So in the eye, as we already mentioned, we have the cornea, the lens, and the retina. The cornea, outside surface, the lens is what needs to adapt in order for us to see up close, to see in the distance. That's what improves our visual acuity. We have the retina that has the photoreceptors that are responsive to the wavelengths of light. Whatever happens in the eye must then make its pathway or make its way into the brain. The pathway into the brain is via the optic nerve. The optic chiasm is that spot in the brain where some of the visual information is going to decussate. It's going to cross over to go to the opposite side of the brain. The lateral geniculate nucleus, as I mentioned, this is super important. This is in the thalamus. As you can read, this connects multiple functions of the visual system, such as visual mapping, the velocity, so tracking how fast something is moving, and then it is in control of the routing of information to the visual cortex. So thalamic issues can be quite significant when it comes to visual processing. We then also have something called the pretectal nucleus. What I need you to know about this is it's in the midbrain. We're going to talk about the mesencephalon or midbrain today quite a lot as we discuss the visual system. It's in charge of a number of different things, but here we see the pupillary reflex. So what happens to your pupil when it is in response to light? We also have the accommodation reflex, meaning when I look up close and I look in the distance, the change in my lens shape to allow me to see, that is called accommodation. These are midbrain activities. So if I have someone that has a hard time looking close and looking in the distance, I might need to do additional midbrain activation in order to improve that, all right? So these are just different things that I need you to be aware of. We also have the superior colliculus. When we look at the anatomy of the midbrain, there are 4 major bumps in the midbrain, right? A neural word for bump or hill is colliculus. So we have the superior bumps and the inferior bumps, or superior hills, inferior hills. When you read a neurology textbook, they will say superior and inferior colliculi. Makes you sound super smart, but it just means bump. All right. Now, what this part of our midbrain is dealing with in terms of the visual system, sympathetic responses, right? So in how does our visual system respond when we are threatened? That is going to be in part governed by the superior colliculus. And then stereoscopic mapping of the environment. So our superior colliculus helps us understand kind of three-dimensional space and where things are existing in our visual map of the world. So when people have a difficult time with depth judgment, or people have a depth perception, some people call it, we may find that we need to work in the midbrain. The visual cortex, this is obviously the part of the brain that's going to do the heavy work of integrating information from the right eye and left eye, trying to make sense of things. After information goes into the occipital cortex, it will then move into the dorsal and ventral streams for additional processing. So this is just information about the mapping of the visual system. So if you read, the right visual field maps on the left visual cortex and vice versa. This is just a definition of the right visual field showing up in the left cortex and the pathways around that. So even though vision is complicated, what I need you to take away so far is that there are multiple brain areas involved. That means that we can use the visual system to target different areas of the brain for activation. I want you to also keep in mind that for now, in the eye phase discussion, just think about the right visual field is going to map onto the left occipital cortex or left visual cortex. Just keep it very easy, all right? Now, dorsal stream and ventral stream processing. This is a kind of cool little picture, but basically what I need you to understand about the visual system is after my eye does its work, my retina does its work, my optic nerve does its work, things go to the back of the brain in the occipital lobe, we now have to continue processing vision, right? We have not yet understood what we're looking at. So we have the dorsal stream, right? And you can see the dorsal stream here is the superior arrow. It's this red arrow. And if you look at the dorsal stream, it should be apparent to you that it is going to be moving toward the parietal lobe. So whenever we talk about the sensory system, we say that the somatosensory cortex lives in the parietal lobe. In structure, whenever we give the lobes different names, we typically will say that the parietal lobe is for identifying where things are in space. So the dorsal stream of vision is involved in where is it, all right, or how is it moving. So whenever we think about a smooth pursuit exercise or something that we're going to be doing with a client, if we're asking them to track a moving object in space, we're asking them to identify where is it and how is it moving. That is a strong dorsal stream process. If we then look down to the ventral stream, you can see that the ventral stream is going to be involving more of the temporal lobe. Now, if you don't know much about the temporal lobe, the words that you would use for the temporal lobe is it is the what is it part of the brain. So the parietal lobe, where is it? How is it moving? The temporal lobe, what is it? So the temporal lobe is involved in helping us recognize things, putting names to things, so object recognition. So now, if I had a client and they were doing letter ball, right, at Essentials, you had them throw a ball back and forth, hopefully without spin, and their job was to track it and then also call the letter that they were seeing as it was coming into their hand. So where is it? Dorsal stream. And identifying the letter, what is it? Ventral stream. So depending on what your client is experiencing, you may need to upregulate the dorsal stream or upregulate the ventral stream by choosing how you perform a given exercise or a given drill. If someone has had a brain injury, it becomes even more and more important to kind of isolate out these two different streams to identify what is my client struggling with, what current systems are underperforming, and how would I go about upregulating them. So this is a very, very powerful hypothesis. As I said, this is probably the most commonly accepted version of how vision works. There are other hypotheses out there with regards to how we process visual information, but we feel pretty comfortable with this one at this stage. If something changes radically over the next few years, we'll obviously update it. But the cool thing is that this is a workable tool, and it allows you to really hone in on what your client is experiencing and know how to, again, identify particular issues. All right, so as we start getting into eye movements, this is going to be, I don't want to say this is super challenging, but it is kind of challenging. What we're going to do is we're going to look at eye movements once again from the eye face perspective of breaking into the cerebellum, brainstem, and cortical control or cortical involvement. The key takeaway here is that if someone has a cerebellum problem, you can influence cerebellar function by using appropriate visual drills. If someone has brainstem dysfunction, you can influence the brainstem with appropriate visual drills. Same thing for the cortex. If someone has a cortical dysfunction, you can influence the cortex with the appropriate vision drill. Now, I could take those sentences and reverse them. If someone has a visual problem, you may improve their visual functioning by stimulating the cerebellum. So remember, in neurology, everything works in loops. If someone has a vision problem, I can maybe improve their vision problem by enhancing cerebellar activity. Depending on the vision problem, I may improve it by working on their brainstem. This relates back to that first rule of things that live next to one another act on one another. So please hear me very clearly that this is a loop system. I will use the visual drills to improve cerebellar, brainstem, and cortical function. I will also use cerebellar drills, brainstem drills, and cortical drills to improve visual function. It kind of depends on what the client needs at any one time. So as we go through, and we go through the anatomy, keep this in mind. Because what happens sometimes, people go into eye phase and they immediately think, I need to start solving my client's visual problems. Well, if your client is unaware that they have a visual problem, and on testing, working on their eyes doesn't do a lot to lower their threat, then you may need to focus on something else. You might need to use visual stimulation to actually target a different area of the brain that provides you a higher benefit for the client. So don't let that confuse you. Just remember, everything's a loop. I can improve your vision utilizing the brain structures or neural structures. I can improve your neural structures by using your vision. All right. So I love this because it makes it interesting to try and put together the correct combination for what your clients are experiencing. All right. So as we start to dig into eye movements a little bit, I'm just going to show you some charts about different areas of the brain that are involved in controlling different portions of the eye movement. So there's a lot of names here. But if you look here, we have, first of all, it's called the frontal eye field. Frontal, F-E-F, should tell you this is in the frontal lobe. So we have different areas of the frontal lobe that are going to be engaged when we create eye movements. So you see the supplementary eye field and the frontal eye fields. These are involved in planning of what your eyes are going to do and initiating certain movements of the eyes. The dorsolateral prefrontal cortex. We don't do eye movements typically at random. There is a decision-making factor. So our dorsolateral prefrontal cortex is our home of executive functions, right? It allows us to make cognitive decisions about what we're choosing to do. One of the most important things that we choose to do on a moment-by-moment basis in life is decide where to look, what to look at. If you've ever taken a speed reading course, right? So maybe, I don't know if you've ever done any speed reading, but one of the first things that you have to train people to do in speed reading is we have to direct their attention in the appropriate way. So rather than looking at one word, we're trying to get them to look at blocks of 3 words. Rather than moving at their habitual speed, we maybe use their finger to drive them to move their eyes more quickly. These are actually conscious decisions that you have to make about how to use your eyes. So dorsolateral prefrontal cortex will be involved in most of our visual decision making. As we move posterior, we have the parietal eye fields. We were just talking about the dorsal stream of vision. Where is it? The parietal eye fields are also going to be involved in helping us plan where our eyes are going to move in space. We have the temporal eye fields. You will hear or read a lot about what's called V5 in the MST. These are very commonly referenced areas in relationship to visual processing. So we have parietal, we have temporal, we have the occipital lobe, posterior, the area striata, which is V1. That's the, again, without getting complex, that's the initial portion of the occipital lobe that will process visual information. We have multiple layers where we add texture to what we're looking at. The vestibular complex is very much implicated in a lot of our eye movements. So we're seeing, again, a large grouping of different parts of the brain involved in visual processing. If you shift over here, we now have cut the brain in half so that you can also see a lot of the different regions of the brainstem that are also involved in eye movements. So I'm going to show you a different picture just to make this easier. Whenever we go more deeply into this, obviously we have the occipital lobe we've already mentioned, the middle temporal visual area, which I was just talking about, V5, the medial superior temporal visual area, that's the MST. We have the parietal eye fields, we have the frontal eye field, supplementary eye field, the DLPFC, the cingulate eye field. If you're not familiar with the cingulate cortex, we have an anterior and a posterior. The cingulate cortex is considered to work hand in hand with the frontal lobe. And in most cases, if you're just reading about the anterior cingulate cortex specifically, we will relate function or we'll relate activity of the ACC to your ability to focus and concentrate. So whenever I'm looking at something and I'm forcing myself to look at it and I'm trying to pick up detail, we have to engender that process through brain activation. So we're going to see the cingulate eye fields becoming more involved in looking at an object and choosing to stay focused on it. We have the insular cortex, which is, as we mentioned yesterday, it's a primary processing area and integration area for all of our sensation, and it is related to interoception. So most of the time when we talk about the visual system, we're thinking, oh, I'm getting information from the outside of the body, but vision work also has a strong interoceptive component because it is allowing you to know where you are homeostatically. More pictures. This one actually is just another iteration of what we've just looked at. Posterior parietal lobe, the temporal lobe, occipital visual area, frontal eye field, supplementary, and basal ganglia. Now, the only addition to what we've talked about so far, I didn't talk about it on one of the previous slides, is the fact that the basal ganglia, just like we talk about in terms of overall motor control, is also going to be involved in helping plan eye movements. And you can see at the bottom, this pathway regulates the interaction of voluntary and reflexive saccades. So there's a lot going on. So whenever we talk about the visual system, including, and visual skills, including massive areas of the brain, this is what we're talking about. So again, we'll get into this in more depth in other courses whenever it is more appropriate. What we want to start looking at is how do I simplify this very complex visual material into something that I can begin applying this afternoon or tonight if you have a session. So what we're going to start off thinking about is control of smooth pursuits. All right, control of smooth pursuits. If we kind of talk this through, this is a basic, I should say, I hate to use the word basic, but there's actually a basic description of how a smooth pursuit, which is tracking a target, moving across my visual field in a given direction, how that occurs. So what I want you to do is look down here at the bottom and you see that the blue circle says pursuits ipsilateral to the hemisphere of origin. All right, pursuits ipsilateral to the hemisphere of origin. So put your finger up in front of you, look at it, move it to your right. All right, so do that again. Put your finger in front of you, look at it, move it to your right, and you're just following. So what you've just performed is a pursuit, right, ipsilateral to the hemisphere of origin. So what that means is that a rightward smooth pursuit is originating in your right hemisphere, your right cortex. Finger up, move your eyes to the left. What this means is that a smooth pursuit to the left is originating in your left cortex. It literally can be that simple to begin with. Now, if you look at everything that's involved in this process, it's much more complex. In order to make my rightward smooth pursuit, I have a lot of things happening. So visual field, the target is in motion. I have the striate cortex, which is the occipital lobe. I have the parietal cortex. I have the frontal eye fields. I have, in the brainstem, we have the DLPN. I don't want to get into that right now. But what you start to see is that we have a series of interconnecting messaging that's occurring right now, again, in the ipsilateral cortex. I have the superior temporal area on the opposite side of the body. They are talking back and forth. So I have right cortex and left cortex temporal lobe having a discussion. As a part of this first pathway, I have first decussation. So the movement commands are going to cross over the midline. They're going to go to the cerebellum. They're going to go to the flocculus, the paraflocculus, the uvula, dorsal vermis. So a lot of the stuff that we discussed yesterday about the cerebellum, we now see the cerebellum getting involved in the control of a smooth pursuit. That is going to talk to the vestibular nuclei. The vestibular nuclei are going to go through a second decussation to help control the abducens nuclei, which is going to make the eye move laterally. Now, everything that I just said probably sounded like a foreign language, which is why it starts off very simply. Look at something, move your eyes right, right hemisphere. Look at something move your eyes left hemisphere. I need you to keep it very simple, but recognize that there are many places where this can go right and where it can go wrong. So a smooth pursuit I can use to create ipsilateral cortical activation. If I have someone that has a right cortex problem, I can use a rightward smooth pursuit to increase right cortical activation. I can also use smooth pursuits to go after the brainstem. I can use smooth pursuits to affect the cerebellum. I can use smooth pursuits to affect the vestibular nuclei. So one simple eye movement can be used in multiple ways. And this is why I was saying, don't let the detail derail your willingness to just test things. So your first starting point for smooth pursuits, if I move it to the right cortical activation, move it to the left cortical activation. All right? So what we're going to do is I'm going to start off, and we're just going to do a little bit of a round robin type of testing process for you. I'm going to bring Micah out. We're going to do some basic examples of using smooth pursuits to maybe change cortical competency. All right? So we're going to start off thinking about the cortex. What do we know about the cortex? We know that her right cortex is going to be in control of voluntary movement on the left side of her body. Yesterday, we spent quite a bit of time working on her left cerebellum because we identified some cerebellar deficits. Okay, so let's again think this through. If we test her left cerebellum, right? So I have her do wraps on her left side. We don't have to do it just yet. Understand that she's making a voluntary movement occur. That voluntary movement plan is coming from her right cortex. It's going to her left cerebellum for control and coordination, our ABCs. So whenever we do that cerebellar test, it is not solely testing the cerebellum. It is mainly testing the cerebellum, but it is also giving us a window into right cortical function. All right? So having said all of that, we're going to begin, and I want you to do this with me, we're going to begin by doing some cerebellar testing. We'll see what we find. We're then going to see if we can think through the process of how would I use a basic smooth pursuit exercise to improve the cerebellar function via activating the cortex. Okay? So let's start off with basic hand tapping. Okay? So we're just going to have her do hand tapping first. We'll begin on, let's do it on your right side first. All right, when you're ready, start your go. Remember, for cerebellar testing, about 5 seconds. We're looking at rhythmicity and speed, and stop. Switch hands. All right, and go. 4,005, and relax. All right, not bad, but you can see she's like, getting tired about 3 seconds in. So a little bit similar to what we saw yesterday, but the rhythmicity of the movement was quite good. The speed was quite good. So let's go into now finger tapping. Remember, we did the finger tapping test. It's index finger to the crease of the thumb. So do this with us. Ready, right hand, go. 3, 1004, 1005. As the coach, you can stop. As the coach, I'm watching. I am trying to see how fast is she moving, and is she regularly hitting the crease. If you want to make this one more difficult, ask them to open their fingers a little bit more, make it a little bit wider. A lot of people will just get here and try to just tap, so make it a larger test. She's doing good with that. Let's now look at the left side and go. 1001, 1002, 1003, 1004, 1005, and stop. All right, so you can see on her face, it's fatiguing. Is it fatiguing?
Yeah, it just gets fatigued.
Okay,
earlier.
So right now she's fresh. It's morning, so the speed so far has looked pretty good, but she is noticing some degree of fatigue. All right, so we've gotten 2 cerebellar tests. Let's go to now wraps. So we're going to do rapid alternating pronation supination. We're going to do both the distal, remember that's for the lateral cerebellum, as well as the proximal joint for more the intermediate cerebellum. So start off the right hand wraps and go. 4, 5, stop. And switch hands and go. 4, 5, and go. Okay, so she made it to 5 seconds. That's at second 6, she lost control of her elbow. So pretty much the same as yesterday, but better. Actually, I would say that the overall, particularly her wraps testing on the left, is better today. We're still seeing more of an endurance issue. So we would like to upregulate all that. So now let's do the proximal joint. Remember, when we do the proximal joint, fingers together, thumbs together, we're going to have her do a quick set of bilateral, okay, internal, external rotation of the shoulder, and go. 3, 4, 5, and relax. So again, that was very similar to what we saw yesterday. Actually better than the distal. So in her case, what we're looking for still is more lateral cerebellar deficits. That's what's showing up more. I'm going to go back and do Romberg's in a minute. We'll see how our midline is. Let's go to the lower extremity. So I want you to do toe tapping. So you can do right side first and go. 2, 3, 4, 5. Relax. And left foot. And when you're ready, go. 2. And stop. Okay. So left side, still in that lower extremity, we still see some issues there. Now we're going to go to the midline. We're going to test her Romberg's with perturbation. So we've already cleared her for Romberg's. We know that she's safe to just get in position, close her eyes. All right, eyes closed. I'm watching for sway. I'm going to start to add some perturbation. Okay. She was really solid on the first one, so I was like, I'm going to hit her harder. So we see, again, a little bit of bilateral actually today, a little bit unstable. That may be due to fatigue. One of the things we've found after, this is now our 7th or 8th day in the studio, having bright lights shining on you all day, if you already have a little light hypersensitivity, can cause some weird responses. But overall, midline's not bad. Now, we did a lot of work yesterday to upregulate her, all right, to see if we increase cerebellar activation, how would she respond. Yesterday, one of the things she responded best to was air hunger work and some of the breath work. So again, to give us a clear indication of how she responds to vision work, I'm going to have her do a brief set of air hunger drills. So we'll do the same thing that she was doing yesterday, which is just a inhale, full exhale, squat. Remember, yesterday it was about 7 reps, not 10. Because remember, whenever they finish the air hunger drill, we don't want them to come out and be gasping and start hyperventilating, because that defeats the purpose of the drill. So do 5 to 7 reps. We're going to do that twice just to quickly increase CO2 levels. And then we're going to retest. And then from there, we're going to start looking at using the visual system. All right, so on your own, when you're ready. Great way to warm up in the morning. 5, 6, 7. Okay, good. So remember, give them 2 breaths to get in control of themselves. As soon as she feels in control, she's going to do one more round of that. And if you're doing this with us at home, just make sure that you're using an appropriate rep range for yourself. If you can go to 10 or 20, that's fine. Okay, second round's a little bit harder, so she's back in control. Again, all that we're doing is changing blood flow. We're working on a little bit of fueling for the brain because of what we're about to do. Let's see how she responded to that now. We'll go immediately back to Romberg's with perturbation. All right, so close your eyes for me. Okay, good, and relax. So her response today is not quite as sharp as it was yesterday, but that was a little bit better. Did it feel more stable to you?
Yeah.
Okay. So we're trying to basically set a foundation. If you watched how fast this goes, particularly if you're not discussing it and trying to teach it, you can do a quick cerebellar screen on a client in about 90 seconds. They walk in the door, you've warmed them up, let's see how you are. Romberg's with perturbation, maybe sharpen Romberg's. I could do finger nose testing, and then my basic wraps, etc. So again, in maybe a maximum of 90 seconds to 2 minutes, you can already have an idea. Does the client today need midline cerebellar activation, intermediate cerebellar activation, lateral cerebellar activation? Which side of the body does that need to occur on? And then that can go into my planning stages with regards to what we're going to do in terms of exercise. Now, we've seen where her cerebellum is at. We've done some air hunger work, hopefully to potentiate the brain for what we're about to do. If we now start to think about her, knowing that we need to improve her left cerebellar function, and we understand our basic cortical processes, which is my right cortex is talking to my left cerebellum, I would want to try or test with her rightward smooth pursuits, okay? So if we again remember this, a pursuit is generated in the cortex ipsilateral. So if I'm doing a rightward smooth pursuit, I'm going to get right brain activation. We're going to see if doing right brain activation for her improves her left cerebellar activity. So hopefully I've said that enough times that it makes sense to you and it's not confusing. As I said, don't get lost in these details right now. We'll do some stacking later where we'll add more of these details. Right now, you need a simplified concept. So whenever we first begin doing smooth pursuits, we are going to typically just test the horizontal movement, all right? We will add some vertical directions to it and diagonal directions to it a little bit later, but the simplest way to test this in the beginning is going to be a horizontal smooth pursuit. So what we're going to do, I'm going to move in front of her. I'm going to kneel down so that you can watch her eyes, and I'm going to be using a pen for the smooth pursuit target. Now, if you guys can focus in on her eyes, remember we're going to be doing this to her right. So I'm going to hold this pen up. Typically I'll be at arm's length, so I'm going to be out just a little bit. So stick your arms out in front. Okay, so arm's length. Can you see the top of the pen?
Yeah.
Is it weird in the background? Would it be better to use the white Z?
Sure.
Okay, so because we have a black background here, I want to make sure that she's able to see the target. What I'm going to do is I'm going to begin at her nose, and then I'm simply going to move this to her right and have her follow it, all right? When we get to the end, you're just going to stop and close your eyes. Okay, ready? Close your eyes. All right, back to the middle, open, find your target, follow, close your eyes. Back to the middle, follow, close your eyes. And we're going to do two more. Follow, close your eyes. And last one, follow, close your eyes. Okay, and relax. Now, we just did literally 5 simple reps of a rightward smooth pursuit. That's all that we did. I haven't even told you what to look for yet in terms of what's a good smooth pursuit versus what's maybe a little bit more compromised. We'll get into that later. You should be doing this with us because I want you to see, does just a simple cortical activation utilizing a smooth pursuit make a difference in their overall movement processing? So we're going to go back and do a quick set of retest. So we just went after her right cortex. We're going to see, did that impact on her midline stability? Eyes closed. And we're going to add some perturbation. And yes, that is an improvement. Let's quickly go to RAPS testing, all right? So her left hand, we'll look at her RAPS and go. That's a significant improvement. Much less fatigued.
Yeah, and more control.
Okay, so right away you can start to see that this athlete, I might, yes, need to do a lot of complicated eye phase drills and eye phase work, movement work, but I might want to set them up for success to do complicated joint mobility work by ensuring that she has higher levels of motor control. In her, what we're seeing immediately is that we're impacting her motor control by improving cerebellar function using an eye drill. And how many reps did we do? 5. It improved her midline stability. It improved her lateral cerebellar activation for a very minimal investment of time and energy. That, to me, is super cool, and this is one of the reasons that I really love utilizing the visual system as an intrinsic part of the training process. All right? So now what we're going to do is we're going to do the reverse. We're going to do a leftward smooth pursuit, and then we're going to retest. All right? Once again, I'm trying to show you that directions matter. Understanding the brain matters. All right? So we'll see. Again, she's going to give me that arm's length distance. Is that about the right height for you? Okay? So we're going to repeat. We're going to do 5 reps of smooth pursuit. We're now going to go to her left. When we do a leftward smooth pursuit, we are activating the left cortex. All right, are you ready? Follow. Close your eyes. Follow. Close your eyes. Close your eyes. And last one. And relax. Okay? I don't know why she's smiling. Can you feel changes?
Yeah.
All right. So what we've done now is we have now stimulated her left cortex. All right, stimulated her left cortex with a left smooth pursuit. Let's repeat our test. Eyes are closed. Sharpen Romberg's test with perturbation. Okay, that is absolutely horrible and quite ridiculous. That leftward smooth pursuit is causing that big of an issue. Let's go back and look at her RAPS test and go. I love neurology and I hate neurology, okay? Now, the reason that and I actually, honestly, I didn't know it was going to be this significant today. This is why it's really fun to just work on people and see what you find. Why this is so important. Whenever I was introduced in school to neurology testing, here is what standard smooth pursuit tests look like in a typical neuro exam, all right? So it would look like this. I'm gonna just have her turn a little bit this way so I can talk. So a typical smooth pursuit test, you would have the client focus on the pen or the object and you would just say, okay, just follow it. And we would move it back and forth at about this pace. And then you would also add your vertical directions. So this was called Big H testing. And the whole idea here was just to look at the control of the eye muscles and isolate the smooth pursuit to the smooth pursuit mechanism centrally, all right? So I try to identify if they had a brain injury. Now, based off what you've seen already, do you think we might need to, on the training side of the world and on the performance side of the world and the pain relief side of the world, be a little bit more specific than the Big H? Because depending on the direction I choose to start and end the exercise with, on a reassessment, I might get a great reassessment, I might get a horrible reassessment, all right? So let's watch this. Big H. What we already know about Micah is that giving her a rightward smooth pursuit to increase right cortical activation has tested well for her. Giving her a leftward smooth pursuit for left cortical activation, really, really poor response. So, as the examiner, watch the difference here. And we're just going to see what happens. All right, so I want you to follow the pen, all right, with your eyes. And I'm going to begin going to her left, go up and down, and now follow to the right, and go up and down, okay, and relax. So, without knowing what we've already seen, in this particular case, let's say I just randomly went to her left first and then I finished to the right. So we're now going to test her, so eyes closed, and we'll test Romberg's with perturbation. Okay, not bad. And let's go ahead and test RAPS and go. All right, that's still better than where we started. Remember, I went left first and then I finished to her right. Now, okay, we're gonna do smooth pursuit. All right, you ready? Mm-hmm. All right, so follow. And follow. And good. All right. Same exact test. Okay, she closes her eyes. Romberg's with perturbation. Okay. Stop. And let's see RAPS. And when you're ready, go. Okay. So I think neurology is making its point for me. This is one of the reasons I love our curriculum and I love understanding these things. If we think about how did all this come about, right? When did doctors start looking at the eyes? When did we start noticing that there were brain areas involved in control of eye movements? You can actually track it way back to war injuries. Back in France, I think in the late 1800s, when some doctors noticed that guys had gotten shot in the head, honestly, had weird eye movements. So those were some of the earliest indications that if you mess up the brain, things happen with eyes. But if you think about how our kind of traditional educational process has gone, most of the time when people are looking at eye movements, they are not judging eye competency from this perspective. They're not looking at eye movements as a part of an integrated GPS system that's designed to allow you to move efficiently and comfortably through the world. Instead, eye movements, kind of like mechanics or biomechanics, are taught to say, does this person have an identifiable central nervous system disease? Have they had a stroke? Have they had a significant injury? We will show you some videos of people who have had true injuries, and you can see the resultant impact on eye movement. So I'm not saying that if I'm trying to identify if she's had some kind of serious brain injury, that the big H is a bad test at all. But what I am saying is that that is an appropriate test for a certain subset of the population. For the people that most of us are working for, or working with, that we're trying to improve their movement, we're trying to decrease their overall threat perspective, dividing up the visual system, understanding that a smooth pursuit right goes after the right brain, smooth pursuit left goes after the left brain, and then adding in some more of the detailed information as we move forward will turn vision drills into a very specific tool that you can use to target improved movement. So as an example, if I were to give her a complicated eye phase drill on the left side, yesterday we had her doing a anterior lunge, lateral tilts, I think, maybe an external rotation. We did a wide variety of things. So we know, let's actually get you into an anterior 45 lunge with the left leg. All right. If I have her begin doing just a basic knee circle on the left, you can watch that. You can watch the smoothness. You can watch the quality. Obviously, if I had a band on it or I was perturbing her in the process, we could make this more difficult or more challenging. But I'm just right now watching it, and I'm looking at the amount of control. All right. Now, basically what you can see with her is at the initial stage, and as she gets into that deeper valgus position, she loses a little bit of velocity control. And can you feel that?
Yeah.
All right. So what I mean by that is there are areas of the knee circle where she is kind of jumping. Yep. She's jumping through the motions. Now, if I saw that, go ahead and come back up, and I've already done my cerebellar testing, and I already know that her cerebellum is maybe compromised on the left side, and that, because I know my other loops, says, hey, right cortical activation might help. I might be able to now solve some of her velocity control problems in her left knee simply by utilizing a rightward smooth pursuit, because we've already tested that. So let's do that, and then we'll go back and review that knee circle and see if it made a difference for her. So again, I'm going to just kneel down. I guess you guys have already seen it, but just in case. All right. So we'll zoom in on our eyes a little bit. We're just going to be going to the right, so get nice and comfortable for me. All right, you ready? And just follow the pin. Close your eyes. Follow the pin. Close. Follow. Close. Follow. Close. I'm going to increase this a little bit. What I'm going to do with her eyes closed, close your eyes a little bit. I'm going to actually position the pin a little further to her left. So she's going to open, she's going to find the pin, and we're just going to increase, close, the size of that rightward smooth pursuit, hopefully to increase a little bit of activation. Now, I could go faster. There's a lot of different things that we can do to regress and progress a smooth pursuit. But now we've reactivated that right cortex. Let's do a quick cerebellar review. So we'll look at midline, rhomboid perturbation, eyes closed. Okay, and again, immediately more stable. Now, more importantly for me as a movement guy, let's look at this knee circle. All right, so on your own, just start the knee circle. And opposite direction. And if you can see, and I think the camera work is so good, you can actually see the velocity is much more controlled. Can you feel the difference?
Yeah. It's
Right.
less scary to go there.
Less scary to go there. So remember that whenever we are dealing with range of motion issues, all movement issues, everything is related to the predictive nature of the brain. So if I have eye movements that are problematic, if I have visual skills that are problematic, interfering with my GPS, even if it's something as minor looking as a smooth pursuit, fixing that or beginning to work on that, creating that appropriate stimulation is going to echo out into the rest of our movement system. This is why this concept of the neural hierarchy is so important, why the concept of the 3 satellites and making sure that we're getting good, clear information from each of the satellites and that we're able to integrate them well is such a vital starting point. So we've gone through quite a lot of stuff, just trying to get you excited about the visual system. Remember, don't get lost in the details right now. The only major takeaway that I want you to have currently is you know what a smooth pursuit is. I'll show you good and bad smooth pursuits on video here in just a minute. You've seen me do it with Micah. The takeaway is rightward for right cortex, leftward for left cortex. We'll add in diagonals and some other things a little bit later as we get into the vestibular system, but this is a really super cool, easy introduction into the potential power of just simple, well-done visual skills. Hopefully you noticed a change in your own body. You may have not, because your smooth pursuit systems may be functioning just fine. But in many cases, even though this looked almost staged, it wasn't staged. She's just that responsive to smooth pursuits. If you think about this in a logical way, think about what we're finding with her, that reading, right? So typical Western reading, I go to the right as I'm reading across, but then I must do a leftward saccade. So for her, we're not sure right now if reading is going to be great for her or if it's going to make her feel worse. Knowing her quite well, I know that reading is actually very fatiguing for her. So when we look at her eye movements, it is not a surprise that some of these smooth pursuit things or smooth pursuit findings might correlate with what people experience in their day-to-day lives in regards to how they're using their eyes. So as we get more into history, we'll talk about that. We're already at our second break for the day, so we'll be back in just a few minutes. Thanks.